Hi, welcome to Young at Heart. I'm Tammy Murray, your host, and today I'm really excited to be turning the microphone over to Anna Kelley, who is our Shine Coordinator at the Kingston Council on Aging, for a short series of shows that we're calling Inside Health Insurance. So thank you for joining, and take it away, Anna.
Hello, I'm Anna Kelley, the Shine representative at the Kingston Senior Center. I also work at the Hanson Senior Center, and I'm here to talk about some information that you might be interested in, a little bit of background information on what Medicare is, what the various parts are, and things that will help you when you need to make decisions about signing up for Medicare or making changes to Medicare. So Medicare is a federally funded insurance program that pays for hospital and medical and drug expenses, prescription drug. When we talk about Medicare, typically we're talking about traditional Medicare. Traditional Medicare is Part A for hospital, Part B for medical, and Part D for prescription drug. In addition to traditional Medicare, or original Medicare it's sometimes called, there's an alternative option available to you, which is called Advantage plans. You hear a lot about Advantage plans. These are plans that are available through private insurance companies that combine these other three, A, B, and D. So some people call them combo plans, some people call them Advantage plans. Just remember that they're Advantage plans. There's a third kind of plan that's available, which is a supplement plan. Supplement does just what it says it's going to do. It's going to supplement your current coverage. Insurance is a cost-sharing agreement between you and your insurance company, in this case Medicare, where you pay part of it and the insurance plan pays part of it. In the case of traditional Medicare, what happens is there are premiums, co-payments, and deductibles. Those are pretty much defined every year at the beginning of each year. But the supplement plan can help you with either co-payments or co-payments and deductibles. A person who has complete traditional Medicare and a supplement plan will only have to pay co-payments for prescription drugs. I'll say that again. If you go traditional Medicare, which is A and B, and have a standalone drug plan, you can pick up a supplement plan that is either going to cover all of your costs, except for drugs, or all of your copays. Also, there are options through Medicare that will help you pay for prescription drug coverage, but I'm going to save that to the end of our discussion today. So, as I mentioned, Medicare is a cost-sharing agreement. A lot of people don't realize this, but while we are paying, let's say, Medicare Part B, if you're currently on Medicare and you make less than $85,000 a year in your retirement, you're paying a premium of $104.90 per month for your Part B. You may not be paying anything for your Part A. Most people don't. However, what you don't realize is that Medicare is also paying a lot to that fund. In addition to your $104.90, Medicare is paying more than 80%. So this cost sharing is between you and the Medicare administration. So I mentioned that Part A covers inpatient hospital care where there's a deductible, but after that deductible is met by the beneficiary, by the patient, everything else is covered by Medicare. So that's the cost-sharing agreement. Let's say that you go into a skilled nursing facility after a 3-day inpatient stay. the first 20 days of your skilled nursing facility stay is completely covered by Medicare. Also, your home health services that are available to you after you come home, completely covered. Also, hospice care for terminally ill, completely covered. So A is the original part of Medicare that covers inpatient hospital stay, hospice, skilled nursing facility, and some other things. And typically there is no premium. Now in terms of Part B, what does it cover? It covers your doctor visits at an 80-20 split. In other words, you pay 20%, Medicare pays 80%. There is a deductible, currently $147. Once you meet that deductible, then that's the distribution, 80-20. You pay 20%. So let's say, for example, you go to your doctor's office. You've already paid your $147 because you've had some doctor visits this year. Now you go to your doctor's office. The doctor's going to charge $100 for the visit. That means Medicare will pay $80. You will pay $20. There is no coverage under traditional Medicare for vision, dental, and hearing, except under certain conditions. For example, if you have diabetic retinopathy, you may have all of your vision covered by Medicare. As I mentioned, the premium today is $104.90. That may be changing next year, but at the current, in 2015, it's $104.90. Now I'm going to talk about Part D, which is prescription drug plans. There are about 27 plans in Massachusetts, and we're in Plymouth County, so I'm going to talk about those plans that are available to us here. These premiums for Part D range from anywhere from around $20 all the way up to almost $150. Under the drug plan, the traditional drug plan, prescription drugs are put into tiers, with the least expensive being the generics, and the most expensive being the high-cost specialty drugs. Some terms that you'll need to know when you evaluate your drug plan are these. The formulary, that means, I'm going to use the example of the formulary is like your pantry. Are all my drugs in the formulary? That's a question you're going to want to know. So if you're looking for a drug plan and you have specialty drugs, they're not in this particular plan's formulary, you don't want that plan because you want to have the insurance company pay for part of that drug. The deductible, that's how much you pay up to a point, and after that, you'll pay. Typically, the deductible is around $320 or $360. There are a couple of plans that have $200 deductible. There are also plans that have zero deductible. Of course, we like the zero deductibles. Co-payments, that's how much you will pay. So for example, if it's a Tier 1 drug, am I going to pay $1 or $3 or $5? There's also out-of-pocket maximum. That's important to know because during the time that you're paying for your drugs, you may have very expensive drugs, and your plan should guarantee that there'll be a threshold for your out-of-pocket expenses. What that threshold is will differ. So when you're shopping around for a drug plan or an Advantage plan that covers drugs, you'll want to see are all my drugs in the formulary, what's the deductible, what's the copayment, what's the premium, and what's my out-of-pocket maximum. When we talk about Advantage plans, there are plans that combine A, B, and D. Be careful when you're looking at Advantage plans because some of the Advantage plans do not cover drugs. And I'll tell you an example of a recent client that I saw at the senior center. She was paying $147 a month for her Advantage plan. It did not cover drugs. She and her husband were in their young 80s. They were paying out of pocket for their drugs, but they were shopping around. They were pretty savvy. Now her husband was on a much more expensive drug than she was used to paying. She needed help fast. We were able to do something to help her get out of the Advantage plan, go back to the traditional Medicare, pick up a D plan that had her drugs in the formulary. We were able to save her some money that way. So coverage rules under the Advantage plan change, and they vary by company. Now, when I talked about under traditional Medicare having a $1,260 deductible, now you're in an Advantage plan, all of the rules are changing. When I talked about under traditional, there's $1,260 deductible, and after that, insurance pays everything for the inpatient stay and for the first 20 days in the nursing home. Well, that's going to change in an Advantage plan. So you have to be aware of that. In an Advantage plan, they may say that instead of there's no deductible, but maybe you'll pay $250 a day for your inpatient stay. Then when you go to the nursing home, you might pay a certain amount every day, up to so many days. So the rules will change. You want to be sure that that your plan covers drugs if you need it. Some people don't need the drugs. People who have TRICARE, people who have VA coverage with drugs, people who have their spouse is employed and they're covered under a working spouse employer plan. Those are all fine ways to cover your drug cost. And in those cases, yes, Advantage plans without drug coverage would be fine. Just keep in mind that Advantage plans offer some extra benefits, such as vision, dental, and hearing, which are not there for the traditional Medicare. However, you may be able to obtain these extra coverage through supplements. So that's it for the Advantage plans. I'm going to talk a little bit about the supplement plans because people who can afford it go the traditional route and pick up the supplement. Until recently, supplement plan was only under traditional Medicare. Nowadays, there are some hybrid supplement plans that will supplement the Advantage plans. So this is new, it's new territory, but as of 2016, there are Advantage plans that can be supplemented. But under traditional Medicare, there are two levels that are defined by Medicare, and actually here in Massachusetts, they're state controlled. The first level of supplement is called Core. The Core plan will pay for your co-payments. So remember I talked about if you went to the doctor and it was going to cost you $100, but your insurance would pay $80 and you would pay $20. Under a supplement plan, that $20 would be taken care of by your supplement. So that's kind of a good thing to have. Your supplement 1 is a next level up, and that would be the Cadillac version. Supplement 1 will cover your deductible and your copay. These also cover extra things such as vision, dental, and hearing. And they also have an extra bonus that people like, which is if you're traveling, you may be able to use your supplement plan to pay for items, for health services when you're traveling abroad, when you're traveling on a cruise, and so on. So in these cases, the supplement plan backs you up. It backs up Medicare. It becomes a secondary payer to Medicare. In other words, Medicare pays as primary payer, your supplement plan pays as secondary. If you have the supplement one, you don't get any bills. What's nice about that is you have a predictable expense. You're going to pay your premiums, and you're going to know that all things that are covered by Medicare will be covered. So it adds the security to that. That's traditional Medicare and Advantage plans and supplement plans in a nutshell. I'll close here for now, and I thank you for listening.